Consider this, a news and information program recorded on the campus of the University of Nebraska at Omaha. From the Fireside Lounge in the Milo Bales Student Center, here is your host, Carol Schrader.
Hello and welcome back to UN Omaha. Human care, what a nice phrase, but human care is in a little bit of a, well, to put it lightly, a transition stage. If I were acting more like it was a crisis, which many people think it is, it's a crisis stage in Nebraska. My guests this week are going to start out by talking about the 2002 Human Care Profile of the United Way. And this is just out, and it puts a bunch of numbers and figures together that have to be looked at in context, but they're the kinds of numbers and figures that certainly should be discussed at this point in time with our unicamerals meeting in our cities and counties in budget crises. I want to welcome today the people who agreed to join us. Virgil Keller is Vice President of Planning and Community Development for United Way of the Midlands, which covers a 5-county area, 4 counties in Nebraska and Pottawatomie County in Iowa. Chairman of the Human Care Profile Committee and Honcho with Business and Finance at the University of Nebraska Medical Center, and former State Health and Human Services Director Don Lowenberger is with us today, a very knowledgeable and experienced person. And I'm pleased to have just met and welcome Marty Wilson. She's the Eastern Regional Director for Lutheran Family Services of Nebraska. And they're kind of a hands-on group of people. So we've got, no offense, bean counters and statisticians and people that are used to trying to figure out what figures mean, and those that live with the figures day to day. First, Virgil, this is the 4th annual Human Care Profile. And it's a lot of work and a lot of numbers and some pretty good explanations of these numbers. But what's the point?
The point's pretty simple, actually. Most people are familiar with the United Way and its annual campaign. And yes, that's an important part of what we do. But really, our mission is to increase the organized capacity for people to help one another. Capacity is the key word. And by capacity, what the profile is trying to address is, first of all, information, knowledge, so that people can prioritize. There is never sufficient resources for what the needs are comparatively. Therefore, you need to prioritize, you need to make decisions. And the
But
other
you
part
want to know what the capacity should be in
That's
an
right.
ideal world, what we can afford, and maybe how we can make those two things come closer together.
And the other piece of capacity it includes what we call social capital. That is people's willingness and they get involved with the community, they provide the political will and say, we need to do something about this. We need to become a volunteer, we need to support this program, we need to provide the resources. And so those are the two things that we're concerned about, information and social capital. And that's why we do the profile.
Don, you've been involved in crunching numbers, and numbers aren't just dollars, but they're human beings represented by numbers
That's
for
right.
years and years and years. What is one of the most profound things that you saw, and we'll get into some specifics later, but if when you're first reading these, in your experience with HHS and everything you've done with the university, what said to Don Lowenberger, wow?
I think the most troubling thing, Carol, in the profile, and there are good things and there are bad things in there, is that the numbers haven't changed a great deal. With all of the interventions we have done, the trends generally are in the wrong direction and not in the right direction. If I can expand on something Virgil said
You
for
betcha.
a minute, and I appreciate this opportunity because the care profile is only the first step in what we intend. And what we intend is that to be a basis of a dialogue, a discussion, a debate. The numbers themselves are not always unambiguous.
No, and oftentimes they're not up to date.
That's
because
right.
Figures, it takes
They always
years.
trail.
The issue
Year or
is, the issue I think is going to be to get to what works, to set priorities with the resources we've got, and to make sure that we've got the right kinds of numbers in place to see whether or not the dollars that are being spent are resulting in real outcomes. And that's where we hope to get with this process. So what you've got is not a report, but the beginning of a process, we hope.
Marty, you, Lutheran Family Services has actually are dispensers. You are part of the capacity for us to handle some of our social needs. Just quickly run down some of what those are for people that aren't familiar with your agency.
Lutheran Family Services offers outpatient mental health and chemical dependency treatment services for persons of all ages. We also offer some community-based programming services, like through the Temme House, in which we're doing and working with a lot of immigration, resettlement kinds of services, seniors that are isolated. The Leavenworth neighborhood tends to be the highest population in terms of an area in Omaha for crime, prostitution, low income, and so many isolated people there because they're afraid to come out. And so what can you do as a community to bring the community resources together to develop some assets from within the community neighborhoods? One of the other areas we work in is the area of children's services with foster care and placement of children, looking at permanency planning for children that have been in out-of-home care for many, many years.
So these are the kinds of things when you talk about capacity and the need to figure out exactly what is the needed capacity, how can we make it happen, and how can we get an outcome, a positive outcome. Those issues are huge enough in and of themselves, and the United Way has worked very well with its agencies to help offer even sort of an outside objective view of how things are going. Our agencies work really well with our United Way and vice versa. But we have a budget crisis, and it is being felt at every level of government, federal, state, county, city, in our school districts, and it's collapsing in on the localities, the Omahas, the Meads, the Norfolks, the Shadrons. Where does discussing some of these things, and we should discuss some of them, and possibly something like the closing of Richard Young's mental health beds in Omaha, how do these things fit into a discussion of what's going on down in Lincoln or in our county boards or our regional health offices?
I think you first start looking at and to see, as Don said, the disturbing thing is the gauge isn't moving, at least as far as we'd like, just with current resources, much less with fewer resources. And a part of the goal and part of the discussion has to be what is the primary services that we need to hold sacred above all others. That's a tough one. But some of those decisions are being made right now, whether we like that or not.
But I don't know who's making them and what basis they're making on. And someday I'm going to wake up and all the bills are going to be passed in the unicameral and all the budgeting is going to be done, and I haven't really heard much discussion. Not that they're really at that part yet.
That's a good point, Carol, because I think one of the problems, human services are so broad. Where do you look to find a group that is making strategic types of decisions? What we have is a very fragmented system. It's fragmented in terms of funding. It's even more fragmented in terms of delivery system. So you've got two issues.
Give me for example, for people that aren't real familiar with
I'll give you
the
an example.
system.
Federal funding is organized by titles that affect this specific disability or this specific economic condition or this specific health condition. They don't necessarily tie together. They have different match rates, they have different bureaucracies. They might have different transportation systems with different rates for paying for cabs. All of these things interact in the same community and are incredibly confusing to people, but they also dissipate resources.
Excuse me.
Now, if you took this even further, most people don't have just one particular problem. And it's very, very hard to do consolidated case planning or delivery of services with so many different levels of government, so many bureaucracies, so many funding streams, and so many disparate rules and regulations and eligibility.
Okay, assuming you're not going to get rid of that problem too quickly.
I did try it one point in time.
And I'm not making light of it. I'm one of those people that sort of laughs instead of cries, you know.
That's that or cry, yes.
So we've got that, and that's a federal
So that's
issue.
that's a federal, state, and local and private public issue. It's all of it.
Because it affects all of it.
Because our delivery system in this state is essentially nonprofit and private. That's where most of the services are delivered, is under contract to the state. And most of those private agencies are also get assistance from United Way and other charitable and volunteer efforts. So it all does come together in something like Lutheran Family Services, who then has to juggle this mess.
All right, Marty, I think you
Carol,
need to
you
jump in here.
mentioned Richard Young, and we just met today in a large
And I
meeting.
should just refresh people that might have missed it. Richard Young was a psychiatric hospital that had beds for those that were both a danger to themselves and others, or those that were uncontrollable or whatever. And they were the beds where they got immediate mental health intervention, and on a residential basis. And they're going to close April 1st. And I'm assuming they've already stopped taking patients to some degree or another, or will at some point.
Their doors will shut on the 1st. We met today with a consultant that was brought in. We met with state officials, county officials, providers, in terms of what are we going to do about this, because there really needs to be a long-term solution to this problem, but there also needs to be a short-term response. So logically, what is that? Because we're going to have to pull together to somehow figure out what are we going to do with the clients that are displaced. There's not going to be any place to drop those people other than trying to do that now with what's left with Douglas County Hospital and Allegiant Center, but they only have so many beds. So it affected basically on a per day basis about 38 inpatient individuals, but they also offered a whole variety of outpatient services, and so those services are somehow going to need to be picked up in some fashion by other providers, or we're going to have more mentally ill people that are on the streets without services.
And part of the frustration is, and see if you agree, is even the support service. These are people the community may not even see. But let's say for a few $100s they can be provided regular support service, be dealing with the medications, they can be working and so forth. If that stops, now the cost is not quadrupled or 10 times, it's 100 times to take care of this person, put them in an institution, where if you had the few $100s. So the decisions will be and have to be difficult, because again, cutting off that supportive service, you not only you don't save $100,
right.
You just got to spending
more.
another million.
And the other thing that's interesting is that I was trying to pin down the number of those kinds of beds that will exist when Richard Young closes, and no one can give me the number exactly. It does slide a little bit depending on the institution and what's happening then, but I'm getting something like, maybe when this is all said and done, there'll be 90 plus of those beds for a 5-county area, basically, for the metropolitan area, or at least the 4-county area of Nebraska. And that certain amounts of those beds are sort of reserved for the indigent patient. But don't think that that doesn't affect you, because if you have Blue Cross Blue Shield, or you have that, there may not be a bed for your loved one, even if you can afford to pay it. So and this is just one small area of one chunk of mental health. Then there's juvenile justice, all kinds of other areas that are being impacted the same way. And so you're just hearing about the headline of Richard Young, but there are small contractors closing their doors right now, like the Partners Network that was serving juvenile justice, because they weren't getting enough from the county to pay to keep to provide their services. And this is what we're going to see. We're going to see more private and even nonprofits not be able to do some of the things.
The clients aren't going to go away. And one of the things that happens typically in downturns in the economy is that the need for behavioral health, the criminal justice system, all of these are stressed. Precisely.
You pointed out one item and have been around this community, and that was the issue of, and I'm not done with mental health necessarily, but of infant mortality.
Right.
And I think we've been talking about our infant mortality rate in this state for some time. We're not seeing an improvement, and I'll let you give the statistic, but it all kind of starts at the beginning. I mean, literally, from infant, and then these kinds of problems just go on in various things. What did you find?
Just to start with a definition, infant mortality is an infant's death in that first year of life. And that's what counts as infant mortality. Omaha generally, in both minority and white populations, is higher than the national average and has been higher. And infant mortality is such a powerful variable because it's an indicator of all kinds of other things: low birth weight, teenage births, the economy, housing, environment, nutrition, All of those things come to bear on the issue of infant mortality. So it is a very powerful indicator of the general health of the community.
But how many times have I heard state and community leaders say we were going to improve this number? And some states have made progress on their infant mortality rates, but we have one of the, if I recall, correct me if I'm wrong, we have one of the higher ones.
We do. We do.
So if we can't even correct that, and we're facing all these other financial
And again, part of the
issues.
frustration you understand is that in order to move that gauge again, that compass, if you will, it takes a period of time.
Correct, correct.
And the frustration is what we're doing now, will we actually be able to see the results a year or two from now? Not only is the data delayed simply because it takes different agencies and different people that collect that data a period of time to collect it and then disseminate it. So you're always, if you can imagine a person in front of the mirror and if that image was delayed by 5 minutes. You know, you
can't
comb your
react
hair,
properly.
You comb your
Okay.
hair and you wait 5 minutes
Your
to see what
reactions
you
are
did.
all off.
Well, that's where we're at right now, and we need to somehow try to find a way to make the image closer in time, real time, to the reflection, and that's part of what we're trying to do.
Carol, we picked infant mortality as one of 3 areas of focus because it does bring together so many different aspects of the community's health status. But it is also something that all sorts of different agencies and volunteers can rally around, whether they're dealing with education or nutrition or prenatal care or teenage sex or whatever it may be. You can gather them around some kind of issue, and infant mortality provides that focus for collaboration.
So it's kind of a hallmark issue.
It's a hallmark issue.
It says a lot,
That's
and it has one of the highest hopes of getting support, theoretically.
Exactly.
Just
And it's not easily debatable. Who doesn't want a healthy child?
Yeah, it's harder to argue that, well, I don't care if that kid dies or not. They might think it, but they sure as heck won't say it.
And they don't like to think of their community
Right.
That's exactly
as being much higher, or their state much
So
higher.
this is a very, very focal point in generating this discussion around the human care profile.
Okay, so we've got figures, and we've got figures that say like the amount of food stamp dollars has gone down. And people go, oh, well, see, that's good. We don't have as many poor people. That's really good. So we don't need to worry as much.
It's a problem with delayed data.
Well, not only is there a problem with delayed
the
data,
laws
but
have
the
changed.
laws have changed,
The laws
limiting
have
the number of
changed.
people, for instance.
That's exactly right.
So
Well, let me give you a
you
good
have to be
example.
kind of informed when and I'm hoping our lawmakers are.
Well, you make a very, very good point. The number of people on what used to be ADC is not an indicator of poverty right now. Because of the contracts, because of people moving off the
Right.
system, it is not an indicator as perhaps it once was.
Because we changed the rules, and
We
we
changed
did
the
it for
rules.
And how we
a
measure.
good reason. At least
Yes.
it was a publicly supported, by the constituents of this country to reform welfare.
And it did move in this community many people into jobs and productive jobs. But then some of the supports that made that possible, like children's health care
Or child care.
Or
or child care,
That was a
are
big one.
beginning to
Biggie.
move.
You lose
away.
those, they can no longer work. They can no longer afford to work. You look at data, you kind of brought up the question, well, what does it mean? You look at the data about domestic violence, for example, and the trend for the last 5 years is just phenomenal in the number of people using domestic violence shelters. And depending on how you want to interpret that, well, is that good or is that bad?
They're
Well,
going to get help.
There more
That might
people
be-
are going to get help. So you picked it up already. That's a good thing because it's becoming socially acceptable to get help. In the past, you just bore it.
Right, but on the other hand, we are at
Why
or
aren't-
over capacity, and
So
there's
why isn't our prevention working? You see, that's the negative side. If our prevention was doing a better job in the first place, at some point, theoretically, that usage should go down.
I don't want to sound like some bleeding heart liberal or something, but the point is, what you've just said shows two things. It's a double-edged sword. We still have the need for the services for domestic violence, and we have just as big or bigger need for honing in on really prevention services that'll work. So it's both sides need concentration, not say, oh, these figures are gone, so we don't need to worry about so much about this, or we don't have to worry.
And we've become more a little effective in the area of domestic violence, but in the mental health, You see, in domestic violence, somewhat, the stigma of getting help is slowly eroding away. Mental health is still a stigma. You've got problems, you know, pull yourselves up by the bootstraps. Why do you know? And if you have a family problem, that's one of the things you might admit. Maybe they have a little alcohol problem now, but admitting that you have a mental health issue in your family. So the first thing that gets cut is that which people feel uncomfortable.
Well, those getting cut, substance abuse dollars are getting cut. They've gone up and down, but it looks like they're going to be cut substantially.
I think that's true.
So, okay, what do we do now?
Let's go back to your point. There is a distinction in where you put the money between preventive services and just reacting to things that are there with some services. Right now, the state has how many, Marty? Over 5,000 wards of the state?
Oh, yes.
At least.
Children and out-of-home placements.
And there's an indication of where the preventive system is either underfunded, we don't know what to do, we don't have a delivery system in place. But in Nebraska, more and more kids are ending up as wards of the state.
Correct. And
Which is in nobody's
and when you're in a crisis mode, and what you're going to do is only provide services at the high end, the things that you have to do. That's where you're going to see the cutting of what I'm going to call the preventative services, whether it's the
They're always first to be
in-home
cut.
services for family preservations to avoid. Those are the programs that are going to go away because that's the first place it
Well,
seems reasonable to cut from some people's perspective.
In working with foster kids, the thing I have found most that when there was a budget cut, the children that are the most aggressive or need help, I mean, and they're really way out there, that's a problem everybody has to pay attention to.
That's right.
But there are those that are on the edge, families that are on the edge. They can go either way. Children can go either way. And I know nobody likes to think about them, but that's where they start cutting.
That's right.
You know, we can get this kid out of the system at 18. We could keep him till 19, and this kid could really be helped by that, but we can't do that anymore because we don't have any money. Now, we are all taxpayers, folks. So we have to look at some realities too. Where are some of these answers?
Things don't happen in 1 and 2 year time frames. Your point about foster care is very well taken. Who is it after 18 when the foster care program ends? Where do they go? We're building more and more prisons in this state. There is an earlier point to intervene in this process successfully.
Okay, who's strategizing all this? I know the United Way is doing that. What I'm saying is, I'm not hearing anything out of Lincoln that says, yes, we have to cut some dollars. We are not going to raise taxes, and everybody in their living room goes, yay. So who is sitting there promulgating the discussion and we've got sitting in a university system that's facing even more cuts? Who's leading this discussion?
The easiest thing to do in a budget cut situation in government is treat everybody equally.
Oh, you mean that 10% across the board? Billy Bob?
10%, whatever it is, across the board. That is the very easiest thing to do because everybody's ox gets gored by the same amount. But it is not priority
Are
setting.
you saying politically expedient by easy?
I've been through 5 governors, Carol.
You be very careful. Is it possible that easy can be politically expedient?
Absolutely. Absolutely.
Well, let's say easier at least.
At least
Not
easier.
Not necessarily easy.
And I'm not trying to prioritize between human services and education because education is part of that, or the economy, or transportation. But there is within those areas, how do you set priorities so you preserve access to a level of service that's meaningful?
Well, how do you do that in your agency? You have finite dollars. You might get some United Way help. You know you can count on contributors, but you know even that could be a bad
But
year.
it's a limit.
Right. So how you sit around the table? The United Way sits around the table and talks about community priorities. Where is this happening in the state? You're in the pipeline. Where is it happening?
Well, and I think for as much, because one of the things that's real easy to do that we all have to be real careful of is when we're in crisis, we have the tendency, all of us, to point fingers. And it's
Okay.
usually at the
Well, I'm
other.
trying not
and it's
to.
usually
Which
at
doesn't
the
do
I'm
a bit of
actually
good.
trying not to. So I'm saying, where is the discussion? Where are you hearing that the real discussion is?
And I think there are discussions that are going on, very important discussions. The concern that sometimes comes across is when some of those decisions are already made. We're going to have a 10% across the board. So in other words, it's not open for debate. And so what it does is it pits people against one another, and that's not necessarily healthy either. But I know that there are state discussions that are going on. I know that we have an opportunity as part of the public to be there to testify. We know the bills that are coming forth, when they're going to be heard. And I think as citizens, we need to be much better advocates at being at those hearings.
Do you get a little frustrated that, and I just thought of this, the media does not cover the unicameral that much? I'm thinking of the broadcast media in particular because they're talking heads and they're boring.
This is one of my favorite topics. You don't want to be started on this.
I'll give you 30 seconds on it.
There has been a tremendous change, and I don't know whether it's within journalism itself, but the amount of coverage, the amount of background and knowledge that the individual journalists have has shifted over the last 30 years that I've been involved in state government, and I think to our detriment.
But I remember we don't cover that many just talking heads in meetings. But really that's where a lot of this discussion is going to go on. At least I sit in one of those weird people that watches the unicameral on TV while I'm working. But that's because I feel that's my job to do that. So we've got just a couple of minutes, and we have not answered all the questions. We haven't answered any questions really. But if you could suggest in this climate something that would be a benefit from this report, or just in mapping out a path for Nebraska, what would you suggest, Virgil?
Bottom line is to get involved. That's what's key. I know people are busy, they got their jobs, but just because you're a stockbroker doesn't mean you shouldn't be involved either with your school or with your health and human services, some area. You need to take ownership. You need to know what's going on because it does affect you.
In the last analysis, community problems are community responsibilities, not Lincoln's. We're talking about the 5 counties in this metro area with a tremendously generous citizenry in terms of their donations. Now we need to get them involved in priority setting and service delivery.
Marty, you get the final word.
And I think adding on to that, it's part of, we can all sit here and talk about what all the problems are. That's a very easy thing to do because there are many to pull from. But it's in beginning to ask ourselves, one, first of all, acknowledge I have a voice, and secondly, to ask ourselves what part of the solution am I willing to be? Because I think we all have an opportunity here.
Well, start by doing a little Google search on your internet, find United Way of the Midlands, and read this report. Read the highlights of it at least. And you can always go to unoTV.unomaha.edu and watch our shows in archive, and we might try to steer you toward the United Way if you want to get these numbers. Just get involved. I want to thank you, Virgil, Don, and Marty, for being with us, and thank you for joining us this week on Consider This.